This is the abdominal assessment. You start the assessment by washing your hands, introducing yourself to the patient, and getting a brief history from the patient. You'd find out if they had any changes in their weight, in their appetite, or in their bowel habits. You'd ask them if they had a diagnosis of abdominal disease or family diagnosis of abdominal disease, and then any changes of increased feeling of bloatingness or increased gas. You start the assessment by looking at the abdomen. It should be flat and rounded, symmetric. Umbilicus is inverted in midline. No herniation noted. The skin color should be uniform in color. You shouldn't be able to see any bulges or masses noted, which there's none. And then you'd go ahead and start by listening. And you go ahead and listen to the right lower quadrant first. And you should hear between 5 to 30 within a minute. Then you'd go ahead and check for vascular sounds with the bell. Aortic, the renal, the iliac, and the femoral. And then go ahead and percuss the abdomen. And then you'd go ahead and check the liver. So you'd start from the umbilicus, midline, so you feel a change. And then from the fourth intercostal space, mark and measure. Then you'd go ahead and lightly palpate, which would be 1 to 2 centimeters. And you'd press and roll. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Then you'd go ahead and deeply palpate 1 to 2 inches. Then you'd go ahead and put your left hand under, and you're checking the liver and press in while the patient takes a deep breath. Okay. And then you'd go ahead and do the same with the spleen towards the umbilicus. Okay. And then you'd go ahead and percuss the spleen, lateral to the midline. And then you'd go ahead and check for referred pain. You press down and you'd ask the patient if they have any pain here or anywhere else in the stomach.
No.
Okay, and then you'd go ahead and check for rebound tenderness. You would press down and ask the patient if there's any pain when you press down and when you release. Any pain?
No.
Any pain?
No.
Okay, and then you'd go ahead and press down on the patient's leg while they lift up. Go ahead, lift up. Any pain in your abdomen?
No.
Okay, and then you'd go ahead and lift the patient's leg and cross up. Any pain in the abdomen?
No.
Okay, and then you check for Murphy sign, which you'd go ahead and press midline for the liver, and then while you press, you ask the patient to take a deep breath, and if they can proceed with that breath, then there's no abnormalities found. Go ahead. Okay, and this will proceed my abdominal assessment. Thank you.